Chapter 8. Allied Health Professionals. Community Health. The health of the community depends on a large number of people other than medical practitioners and nurses. This can be grouped under the heading of allied health professionals. They include the following: physiotherapists, physios, help people to move by getting them to do exercise, or by treating their body with heat or massage. Treatment by manipulating muscles and joints with the hands. Occupational occupational therapist help people with disability to perform tasks at home and at work. A disability is a physical or mental condition that makes it difficult to live normally. For example, blindness or deafness. Social workers help people to solve their social problems. For example, poor housing or unemployment or family problems. Chiropodists, also known as podiatrists, treat conditions affecting the feet. Technicians. There are numerous technicians, people who work with scientific equipment, such as radiographers, who are known as X-ray technicians. Ambulance technicians work in the emergency medicine service. An ambulance technician with more advanced qualifications is called paramedic. Prosthetics and orthoses. Prosthetics and orthoses provides care for anyone who needs an artificial limb or a device to support or control part of the body. They also advise on rehabilitation, helping patients return to normal life and work after treatment. Prosthetics provide artificial replacement for patients who have an amputation or were born without a limb. Orthotics provide a range of splints and other devices to aid movement, correct deformity from an abnormal development of part of the body. For example, clubfoot, talibs, and relief pain. Opticians. Optician test eyesight and prescribe glasses, also known as spectacles, and contact lenses when necessary. The examination includes measuring intraocular pressure, the pressure of fluid inside the eye, and examining the retina. If the optician suspects an IDC, such as glaucoma, they refer the patient for their GP for treatment. The GP may then refer the patient to an ophthalmologist, a doctor who specializes in diseases of the eye. Make word combinations using a word from each box. Look at A, B, C, and D opposite to help you. Ambulance, artificial, club, contact, health, intraocular, occupational, social. Foot, lens, limb, worker, pressure, technician, professional, therapist. Which allied health professional could best help the following people? Look at A, B, C, and D opposite to help you. A young unmarried woman who has just had a baby. A woman who is having difficulty using her right arm following a fracture. Someone who needs glasses. Another woman who has had a below knee amputation. A man whose wife has Alzheimer's disease. A man with a fungal infection on his feet. Complete the test. Look at A and C opposite to help you. A prosthetics work with patients of all age as a member of a clinical team based at a Lair hospital. The patient may need a prosthetic as the result of an accident or following a disease such as diabetes. Alternatively, they may have been born without a orthotics work alongside doctors, nurses, physiotherapists, and occupational to give the people under their care the best possible. Their main aim is to enable the patient to lead a normal life at work and leisure. And orthotics often work in a clinic as a part of an outpatient service and also visit other centers to provide a service for people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy may require to help them walk, and many older people need special shoes to correct if damaged. Any part of the human skeleton may require some form of orthosis. The orthosis may be needed to reposition the body or to pain.